All right, so maybe one more minute and then we're going to go ahead and get started. And my clock just changed, so maybe we'll just start now. Thanks all. So just a couple more things. There's going to be time at the end for Q&A. We don't permit AI note-taking apps. I didn't see any so far, but if we do see them, we're going to ask that you dismantle them. And just a reminder that we have our slide deck and our webinar recording posted on our Reentry website. Next slide, please. So really excited today about our part 2 provider enrollment webinar. So part 1, we talked about enrolling our carceral facilities, and today we're going to be talking about associating servicing providers to a billing provider. And again, we'll have some time at the end for Q&A, but please feel free to put questions into chat as we're going. So I will turn things over to Erica to kick us off.
Hi, my name is Erica Barranca Balco. I'm a management analyst in provider enrollment, and I'm here today to talk to you about servicing providers and how to associate them in Provider One. We wanted to start out first with some definitions. What is a billing provider and what is a servicing provider? So a billing provider is a correctional facility, clinic, or group practice that wishes to bill Apple Health, Medicaid for Reentry Initiative benefit services. And the servicing provider, which is what we'll be focusing on today, is a facility-based and community-based provider who practices under a correctional facility, clinic, or group practice. They provide the Reentry Initiative benefit services under a billing provider. We'll go to the next slide. So why do we need to associate a servicing provider? The short answer is to submit claims and receive payment. So a servicing provider performs the medical service and the billing provider submits the claim. So in order to receive payment, the two need to be associated in the system, which is Provider One, to properly submit the claim. Next slide. So here's a quick snapshot of the steps that we're going to cover in today's webinar. Step 1 is we're going to need to verify that Apple Health enrollment. So in order to do that, correctional facilities must be enrolled and the servicing providers must be enrolled. Once those two things are checked off, step 2, a modification needs to be submitted in Provider One to associate the servicing providers with the billing provider. In order to do that, the billing provider will log into Provider One into their organizational domain. They'll access the business process wizard under step 14 in the business process wizard. They'll go to add servicing providers. And then finally, they'll submit a modification. And we'll go into that in much more detail. And then step 3 is the approval process. And once a modification is submitted to add servicing providers, it's auto-approved for both the facility and the healthcare professional practicing under a group or facility. Okay, next slide. So next, I'm going to hand it over to Josh Hull, one of the supervisors in provider enrollment, to go into more detail on the steps in Provider One in order to associate the servicing providers. Josh?
Thank you, Erica. Hi, good morning, everyone. My name is Josh, and I am one of the supervisors here with provider enrollment. And like Erica said, I'll be giving you a breakdown of each one of these little steps here to get your providers associated with your billing group. So step 1, you need to make sure that your provider is first enrolled in Apple Health. So correctional facilities themselves, they must be enrolled in Apple Health. Correctional facilities that plan to leverage facility-based providers or community-based providers should confirm they are already enrolled in Apple Health. And facility-based or community-based providers who are already enrolled in Apple Health will not need to take further action. So to check whether a provider is already enrolled, you can go ahead and contact us. You can contact HCA at 1-800-562-3022. Our extension is 16137. And our phone days are on Tuesdays and Thursdays from 7:30 a.m. to noon, and then closed for lunch. And then we're back on from 1 to 4:30 p.m. It's always helpful when you have that provider's NPI number when you call us. It makes the phone call much smoother, and we can get you checked pretty quickly if you have the NPI number. It's not the end of the world if you don't, though, but it's always helpful if you have that NPI number. If your provider is not already enrolled with the HCA, there is another webinar, the Reentry Initiative Provider Enrollment webinar, for more information to get your provider enrolled. If you have questions about enrolling your providers, again, you can give us a call. We're happy to talk about it with you then. All right, next slide, please. So to get your enrolled providers associated with your billing group, what you need to do is you need to submit a modification. So the way to submit a modification is you're going to log in to your organization's Provider One domain. You're going to put your domain number in, your username, and your password, and log in. Once you're logged in, next slide, please. You're going to be taken to the splash screen here when you first log in. On the left-hand side, there are some options for you to get to certain sections of your Provider One domain. What we want you to click on when you log into your domain is that Manage Provider Information link. So when you click on that link, go ahead and go to the next slide. This is where you're going to be taking. This is what's called our Business Process Wizard, BPW for short. So the BPW has a list of steps here, and each one of these steps contains information about your domain, whether it's your locations, your taxonomies, if you have billing agent clearinghouses associated, etc. The step we're concentrating on, though, is step 14, servicing provider information. So when you click on that step, next slide, you're going to be taken to a screen here, and it's going to show you all the providers that you have already associated to your billing group's domain. As you can see here, there are no providers associated with this group yet, but we're going to go ahead and change that. We're going to add a provider. So you're going to click on that Add button, and next slide. When you click on that Add button, you're going to get a pop-up window here. And the first thing you're going to put in is that provider's NPI number. That's required. Also, the start date. When does that provider plan to start services for your organization? You're going to put that start date in there, which is also required. And then you're going to hit that Confirm Provider button. Next slide. Once you do that, you're going to see the available agencies that that provider has for their domain. So this provider here, John Smith, he is enrolled with us already, HCA. So we're going to highlight that HCA agency, and we're going to drag it over to that selected agency. So the way we do that is we highlight HCA, and then we click on that double right arrow, and that'll move it over to the selected agencies box. Next slide. After we do that, the available taxonomies box will populate. And again, you're just going to highlight the needed taxonomies and pull those over to the selected taxonomies group. Once you do that, go ahead and go to the next slide. Then the available locations box will be populated with different locations for that organization. If you've only got the one, just the one will show up here like we're seeing in this example. So we're going to highlight that location address. And again, we're just going to move it over by hitting that double right arrow button to this selected locations box. Once we do that, that OK button will be available. We're going to click on that OK button. And you're going to be taken back to your servicing provider list screen. Now, again, nothing's going to show up here. It's going to say no records found. That's because the provider you just added is in review. Once we approve it on our end, then it'll show up in your available servicing providers list here. So don't be alarmed when you go back and you see nothing here. That is the design of the system. So once we get back to this screen, we're going to hit the close button. And the next slide. And now you'll be taken back to that BPW. And you can see now that servicing provider information, that step 14, is showing as updated. There's been changes to this step. That's what we want to see. Next slide, please. Once we get done adding our providers, and again, if you need to add more providers, you would just keep adding in that step 14. So if you have like 6 providers you need to add, you're going to hit that add button 6 times, add those providers. Once you're finished adding your providers, you're going to go into this very final step, step 17, final steps. Click into that screen there. Next slide. And then you're going to hit that submit provider modification button. This is an important step. Sometimes providers forget to do this, and then they just have that modification hanging out in their domain and nothing happens. Well, that's because they never sent it to us for review. So you need to hit that submit provider modification button. That's the action that's going to send those changes our way for approval. So once you hit that submit provider modification button, next slide, we get to the approval process. And fortunately, this is a very simple step. Most of the time, if you're just adding servicing only providers, that's auto approved the next day. We don't even need to look at it and take action. The system just automatically approves those modifications. If you made any other changes in your domain, it might require one of us to take a look at it and just make sure that it's okay and we can approve that change. That might hold up the process a little bit. You're always welcome to call us and ask if the modification you sent us has been approved yet. We can take a look at it with you. You can also log into your Provider One domain. And again, at this very first screen, this splash screen, you can see that your provider modification is in review or it's been completed by looking in that alert message section there. So in this example here, we've got the provider modification that this provider sent us is completed. If it was in review, it would say provider modification is in review. And that's all there is to it. Very simple process. If you ever have any questions on it, you're more than welcome to call us. We're happy to walk you through this process, but this is a pretty good explanation of how to just add those servicing providers pretty quickly. Looks like we have a question from Sean Davis.
Yeah. So I get this is how we add a provider, so an individual provider, correct? Or
Correct. Yeah,
can I
so
can I
anyone who's
add
enrolled
can I add an entire hospital to this? Because we often have to take
cannot.
So how do we work that? Because we often have to take inmates up to the hospital for CTs, for different tests, and uh, the hospital has so many people that work for them. How is that going to work?
Well, the hospital will have to get enrolled with the healthcare authority as well.
And
And
then,
then the providers that are providing services at that hospital would also need to be enrolled.
so does that mean I need to go through and add every provider the hospital has?
I don't, if the hospital is part of your organization, then yes. If the hospital is a separate entity, then they would need to enroll themselves and their providers.
Wait, can I ask a clarifying question? Is the hospital doing the billing for the services that they're providing? I would imagine that they would do their own billing.
I'm hoping they will do their own billing for anything that involves an inmate. We're so small. Uh, I don't know how we're going to pull off the billing side if they don't do their own billing, or if the doctors that I do contract with one doctor who comes in once a week, if he doesn't do his own billing for it. I don't know how we pull this off. But we deal with Providence Network in Colville, Kettle Falls, Chewelah, and sometimes in Spokane, because we have to take inmates for certain tests. And depending on which one of Providence's hospitals or clinics can provide that test, depends on where we have to go. And then they have so many different providers.
I think we would need to understand who is doing the billing in order to best guide you on how they would to be enrolled.
Okay.
You
And we could
wouldn't.
take a look at that sometime, Sean, if you got a moment. We can take a look and see what hospitals are enrolled. I would assume that most Providence hospitals in Washington State would already be enrolled with us, but we could definitely check to see if they are.
Okay. Thanks.
Hey, this is Kitatas. We put some questions in the chat that we're trying to get confirmed up as we're moving forward with ours.
Maybe I can read those questions. So we have a contracted nursing staff through a contracted medical clinic. The nurses do things that are billable. We are doing billing for the contracted medical staff. Couple questions. And I see, do the nurses need to be added to the contracted clinic's provider one first before added to ours?
So you have nursing staff who are enrolled as their own billing individual. Is that what I'm hearing?
No, so in order for this to work, we're doing the billing for our contracted medical team,
Hmm.
and um, and we're doing it right as a jail. We have our own MPI, we have our own provider one, but
Hmm.
the nurses triage a lot of our doctor stuff because our doctors are only here 2 hours a day, and so the nurses do things that would be billable for those who are eligible for
Hmm.
Medicaid services while incarcerated. The question we're running into is our contracted provider is telling us we just have to add them to provider one so we can start billing for the nurses encounters, or our understanding is the provider needs to add them on their provider one, and then we can piggyback off that. So we're kind of trying to we're in a loophole here. Whose job is it?
You would want to enroll your nursing staff. If they're providing services, then you're going to want to have them associated to your organization, your billing organization. And that's what we just went over here, how to add those providers,
Okay,
how to
and
get
that
them
makes
associated to your group.
that makes sense, but if the nurses are if they're not already on provider one, they're not enrolled. Our doctors are enrolled in provider one. So the confusion lies with the healthcare facility that actually the nurses work with. They they don't want to add them in provider one. They want us to do it, and I understand that we have to do that on step 14, but they're not even provider one
So they're not
practitioners,
enrolled in provider one yet.
not at all.
Right. And I think there was a link to a separate webinar on how to get your providers enrolled in Healthcare Authority. So that would be step one. You need to get those nurses enrolled in Healthcare Authority in Provider One before you
And
can
that,
associate them to your group.
okay, so the clinic needs to do that.
Yes. Well, it just depends on how they're going to be enrolled. If they're going to be enrolled as just servicing providers providing services for your group, then yes. If they're going to be their own billing entity that's going to provide services for you sometimes, then they'd want to enroll themselves.
No, so they should go through the medical clinic. Okay. So the question two is, there's no cost related with them getting enrolled in Provider One, is there?
No, not at all.
Okay. Thank you very much.
You're welcome.
Thank you. I see another question. So if we contract with an in-reach provider who is doing their own billing through their provider agency, does our facility need to enroll with Apple Health Provider One with their own NPI? So the question is about the carceral facility.
So it sounds like it's a community provider who's doing their own billing, and your carceral facility is not providing the reentry services or doing any billing. In that case, then the carceral facility would not need to enroll. The community provider would need to enroll.
Any other questions here?
Is an LPN available to be added on Provider One, or does it have to be an RN?
I think it's going to have to be an RN.
Thank you again.
You bet.
Any final questions? This was a quick one today. All right. Well, I think we can end early then. So, number of resources on our website. Thank you for your time today. And as always, please feel free to email our inbox with any follow-up questions. Thanks all.